I'm going to talk to you today about statutory and mandatory training in the context of health and social care settings. So these terms are used interchangeably in most cases, and sometimes people say statutory training when they really mean mandatory training and vice versa. Does it even matter then which term that we use as long as things are done? I think it does, and I'm going to outline why it does matter in the session. So, quick overview of the aims. We want people to understand the importance of statutory and mandatory training in health and social care settings, and also understand and get to know some of the key legislation and regulations that directly impact what we do in practice, as well as understanding the employer and employee responsibilities with regards to mandatory training. For the objectives, we want to define the terms statutory and mandatory training. We want to outline some of the key subjects that are covered in these areas, as well as the regulatory framework for health and social care providers. So in England, this is the Care Quality Commission regulatory framework. The general principles are the same across the board, but obviously if you're in Wales, Scotland, and Northern Ireland, we're not addressing those countries specifically. We're addressing England, where the Care Quality Commission is the regulator for health and social care services. So the learning outcomes, by the end of the session, you'll be able to define the key terms. You'll also be able to explain how statutory and mandatory training have a direct effect on service delivery and patient outcomes. You'll also be able to explain the employer and employee responsibilities regarding statutory and mandatory training. You also understand the importance of recognizing and minimizing risks to yourself as well as to patients and service users. So I'm mostly going to refer to patients, but obviously that relates to people that are in healthcare settings, for example, acute hospitals, maybe they're in a walk-in center or a GP practice or dental practice. But we generally say service user across the board. It relates to any setting really, for example, domiciliary care and care homes. So let's start with the definitions, particularly the two terms, statutory and mandatory. Many times that I've asked this question, people get really confused because in most cases, people do use these terms regularly, but they have never stopped to think what they mean specifically and what the difference is between them. Okay, so let's start with statutory. So statutory training, we're talking about the training that an organization is legally required to provide as defined by law, or where a statutory body has instructed organizations to provide that training based on legislation. So this is to do with the law. It's not negotiable. If your organization falls under that bracket of organizations that are required to provide that training to their employees, then you have to do it. It's non-negotiable. So examples of statutory and mandatory training, as you can see, I've got the picture of the Palace of Westminster, which is where we've got the House of Commons, where our MPs sit. So every law has to go through the stages of going through the House of Commons and the House of Lords before it's passed into law. So all the intricacies are discussed, the benefits and the implications. Some bills don't pass through, but a lot do pass through because there's always a reason behind every single law and why organizations should comply. So the big one for health and social care organizations is the Health and Safety at Work, ETC 1974. So this covers subjects like health and safety, level 1, level 2, up to level 3, or even higher sometimes. It also covers things like first aid and cardiopulmonary resuscitation, depending on the setting that you're working. We all know about infection prevention and control now because of COVID. Everybody now understands actually that there are viruses out there, there's bacteria out there, and you have to constantly be washing your hands, using hand gel, and even wearing masks. All those types of PPE helps to protect you and others from communicable diseases that we might not be able to see with our bare eyes. So it's even more important for health and social care workers to follow the universal precautions regarding infection prevention and control. Fire safety is another big one. I mean, in England, we had the big case of Grenfell Tower, where a building caught fire, and many people, several dozens of people died needlessly, where the local authority could have done more when they did the refurbishment of that building to ensure that it's safe for people to live in, and also it's safe for people to evacuate in the event of a fire. There's also moving and handling, a big area for health and social care, because there's a lot of moving and handling, people, objects, and there are a lot of dangers that actually come to the people who are doing the moving and handling, but also the people that are being moved. So patients may be being transferred from bed to chair, maybe they're being moved to the top of the bed to a sitting position, or maybe you're walking with them from their bed to the toilet or something like that. All these things really matter. Food safety is another big one. There's separate regulations for some of these topics, but they all fall under the Health and Safety at Work Act 1974. The CARE Act is a big one as well. There were a lot of failings in some organizations that resulted in a big inquiry that led to the CARE Act, and also a change in how the Care Quality Commission regulates organizations that provide health and social care. So everyone now has to do safeguarding adults and children training. We all have to do prevent radicalization, among many other subjects that are related to the CARE Act. Data Protection Act 2018 is a big one. Many people think about GDPR as a subject, or we can talk about information governance, the Code principles, whichever way we look at it. All these things are covered under the Data Protection Act, and we have clear responsibilities as organizations and professionals to apply these principles. Mandatory training, on the other hand, is that training that is determined as essential by an organization for the safe and efficient running in order to reduce organizational risks and comply with policies, professional guidelines, and regulatory frameworks. So the difference here is that the organization has to carry out risk assessments to identify the level of risk for different employees, for maybe different buildings. What are the risks to staff? What are risks to service users? Whether there are risks related to service provision or decision-making by clinicians, nurses, care workers, and also environmental risks, the buildings that we use, the environment around where people are being cared for. So we do our risk assessments and we determine what sort of training is required locally, and we add that into our policies and procedures. Examples of mandatory training, we can look at resuscitation, for example. So the Resuscitation Council UK provide the guidelines on how we do resuscitation, but also these guidelines are used when we do first aid training. So in general, in hospitals, clinically trained people are going to be doing resuscitation training. So it starts at basic life support, level 2. And for people that have direct clinical positions where they're looking after patients, like nurses and some doctors, you have to do immediate life support, which is at level 3. And then for people who are in senior positions and they make clinical decisions, like a lot of the senior nurses and doctors, they have to do advanced life support because they have to do more interventions. Non-clinical members of staff only need to know enough. So it's almost like first aid at level 2, basic life support at level 2, and in some areas, emergency first aid at work, depending on the risk. Think about infection prevention and control. I talked about it in the previous slide. It's really important for everyone now to observe not only the universal precautions, but also always constantly be risk assessing as far as infection prevention and control is concerned. And COVID has really opened our eyes. And personally, I hope that we continue to think like that. Think about social distancing, think about disinfecting your hands, washing your hands, using hand gel as appropriate, wearing masks where there's an increased risk that you might catch infections. Medicines management is another big one. Most of us would have taken some medicines at some points in our lives. They have a purpose, but there are a lot of risks with any medication that you take. They'll always have some side effects, some more serious than others. There'll be some contraindications because some medications, if you're on one medication, you can't take the other. You want to be able to trust the system as well as healthcare professionals to ensure that they prescribe the correct medications. Those medications are stored correctly and they are administered correctly, and people have checks and balances in place, whether you need a double signature, whether some medicines are locked away safely. So every organization will have its own local policies and procedures, and they have to do a risk analysis and then mitigate that risk by putting in place, maybe they train people, maybe they put policies and procedures, double checking when you're giving certain medications, and many other corrective measures that can be taken as well, and preventative measures as well, most importantly, preventative measures. Records management, really important for health and social care. So whenever you say a child is born today, there's a record that the child has been born and what has been done to that child and their whole life, actually from cradle to the grave. We need to know what's happening with them. So if I go to my general practitioner, for example, or my dentist, and then they can't find my notes, they don't know what happened to me last time I was there, how do they know how to give me the best treatment where I am at the time? So you want that continuity of care using good records that are complete, that are straight to the point, that are objective, and that are easy to use as well for anyone who picks them up. So whether they are manual records or they're electronic records, there's a lot that we need to put in place and follow as health and social care professionals to ensure that we look after people's records and enhance their care along the way as well. So what's the difference between statutory and mandatory training? Again, just to summarize one more time, statutory training is required to ensure that the organization is meeting any legislative duties that is required by law. Then mandatory training, it's now an organizational requirement to limit risks and maintain a safe working practice. So we do our risk assessments, and we put in place plans and actions that need to be taken for people to minimize the risk within the workplace. So why are they required, statutory and mandatory training? As you can see on the right, I've got a picture of the lady who is holding these scales, and we know that all this is to do with the law. And there's also a Care Quality Commission, right? So it's a legal responsibility to provide these courses, because if you don't do that, you might fall foul of the Care Quality Commission or even the other regulators, Department of Health, for example, commissioners, and others, local authorities as well. Risk mitigation, that's why we need to do our risk assessments and minimize that risk to service users and employees alike. We also want to have a safe environment for service users as well as staff, visitors that are coming in to see their loved ones, contractors that are coming in for short-term work, make sure that the environment is safe. We want to increase confidence in services. There was a time where, and occasionally you still get up to now, there was a time where I remember in the early 2000s, many hospitals across the country had a lot of problems with MRSA and other infections, outbreaks, where sometimes wards would be closed for several weeks. Patients can't come in or get out. And sometimes even whole hospitals will be shut, for people coming in. Of course, that's what's happening with COVID as well right now. It's no one's fault with COVID, but actually when it comes to MRSA and other infections, we can control those things. But also even what we do as an organization, are we open with the public? Are we open with service users? After all, the health services in the UK are funded by taxpayer funds. We pay taxes that go on to fund the NHS and other providers. So it is our public duty to ensure that we are open and honest with our dealings. So service user expectations, no matter where you go, whether you're in a care home, you're in a pediatric unit, you're in the theaters having an operation done, or you're seeing a GP, our expectations are that we are going to get a diagnosis, we're going to get some form of treatment that is going to make us better. I don't want to come out of the hospital worse, or worse still, not come out of the hospital at all because I've died, because maybe some precautions were not taken, maybe a checklist was not followed through properly. So let's ensure that whenever we see patients, you always think about the outcomes. What is the required outcome here? What is the patient expectation? And we deliver on that. So how do we put this into practice? I've got some pictures here on the right. You got the Care Quality Commission, Stafford Hospital, Mid Staffordshire NHS Foundation Trust. I've got Winterbourne View. I've got Sir Robert Francis QC. So for many people, you know that this relates to the scandals that happened at Mid Staffordshire NHS Trust and even Winterbourne View and many others, which led to the inquiry that was led by Robert Francis QA, who was commissioned by the then Prime Minister David Cameron to look into the failings at Mid Staffordshire NHS Trust and see how CQC, the Care Quality Commission, can improve the way they regulate organizations and how we can improve care across the board. So to summarize, I mean, it's a big document. I think it's about 5 volumes of that inquiry alone and many other publications since then. But CQC have changed the way they inspect health and social care organizations. So they ask 5 questions now. Are you safe as an organization? So if I come in as a patient, what sort of care do I receive? Do people know what they're doing? Are they trained properly? Do they have the qualifications and experience? Also, do you have good systems to check for safety, safeguarding, health and safety, fire safety? All those things matter. Are we effective as an organization? The care that we provide, what are the outcomes? So we have set standards for different types of services. Are we meeting those minimum standards? And also, it's better to exceed those minimum standards. If you aim for minimum standards and then you don't meet them, you're already failing as an organization. Then caring is much more difficult to measure how caring we are, but what sort of feedback do we get from patients? Many organizations now have very active departments that look at patient engagement. So they look at patient satisfaction. They follow up actually to check patient experience to ensure that it's the most optimal that we can give. Responsiveness is important as well. Are we responsive as an organization? Because care needs change. I can go into hospital with an acute illness. I might not recover, or I might not be able to, maybe I have a heart attack or something like that. Then my heart is not working as well as it was doing before. I'm much weaker. I'm short of breath. I cannot walk even 10 steps without stopping to catch a breath. How do services adapt and ensure that those changes are looked after? I get all the physiotherapy that I need. I get the cardiac rehabilitation and other things that are needed for me to get better and back to my normal self. The final one is, are you well led? Is the organization well led? That's an important one. So general leadership, we're talking about governance of an organization. We're talking about the clinical governance. We're talking about evidence-based care. We're talking about the way we recruit people, how we give them induction training, how we make sure that they stay up to date. We're talking about day-to-day management, the estates management, our laboratories, and other diagnostic tools, and the way we work with others as well, other agencies and other organizations, all that really important. Remember also your statutory duty of candor. So this is the duty to be open and honest to service users when things do get wrong. Like what happened with Mid Staffordshire, we now use it as a case study and we learn certain practices, including whistleblowers who were victimized rather than listened to. So how do we protect those people that are willing to come forward and say, hand on heart, we're not doing so well here. How can we improve? How can everybody else learn and improve across the board? So I finished the session and I just want to go back again to our learning outcomes. We wanted to define the key terms. So we've defined statutory and mandatory training. We've also explained how this training has a direct effect on service delivery and patient outcomes. We also explained the employer and employee responsibilities regarding statutory and mandatory training, as well as a better understanding of the importance of recognizing and minimizing risks to patients when we do find them. So that's the end of my session. If you would kindly please send us your questions on YouTube, you can send the questions in the comments. If you're watching this video from our website, there's a form at the bottom. Fill in the form and send us your questions and feedback. We're happy to hear your thoughts and also see how we can help organizations and individuals who work in health and social care to deliver the best possible care and meet the outcomes, as well as meet the statutory and regulatory requirements that keep our organizations functioning and keep them safe. So thank you very much for joining the session. We hope to see you soon on another session.